90% is usually an A grade on a test, but in the world of vaccines, it has another name.
90% is a game changer. 90%, now you are hoping to have a tool in your war against this pandemic that could be significantly effective.
Albert Bourla is Pfizer's CEO, announcing the earliest results of testing that comes at a time when COVID cases are spiking everywhere.
I think that likely, based on impact, that will be the greatest medical advance in the last 100 years, if you think about it, right?
The Pfizer vaccine is being tested at Children's Hospital with about 500 volunteers and at several other sites around the nation. About 30,000 people are involved in the testing. The 90% effective indicator opens a door for the possibility of beginning the earliest stages of vaccinating larger groups of people.
There's talk about an emergency use authorization where the government has the ability to have vaccines or study products available if there's an emergency that where they need to.
Dr. Robert Frank is working on the Pfizer vaccine at Children's Hospital. He talked to us last month about how the spike in COVID cases could speed up the testing process.
That would be the only silver lining out of the increase in number of cases, is that it would potentially increase the number of cases that occur in people enrolled in the study.
Researchers hoping 90% is the cure for 2020. Yeah, now there's no timeline on this, but if they get that emergency declaration, they could start vaccinating immediately. We're talking maybe before the end of the year. Now, we're also talking about probably folks like healthcare workers, frontline workers, that sort of thing. But again, that they won't probably look at mass vaccinations for everyone until probably sometime after the first of the year. Reporting live, Brian Hemrick, WLWT News 5.
Brian, who else might be in line for early vaccines in addition to those frontline workers you were mentioning?
Well, it could be people that are at risk, like the elderly, maybe people with health care issues, but they could also have a spike in a certain part of town or even in a small town and designate that whole area as high risk and send vaccines there. Cherie?
All right, Brian Hemrick reporting live tonight. Thanks so much. Just hoping and praying that we're talking about a different world by spring or summer of next year. Hey, you know what? Wall Street